Hello, I'm Tom, founder of Tom's Heart. I created Tom's Heart after a series of consistently inconsistent primary care physician, hospital, heart attack specialist care over the course of 3 or 4 years. 2 years leading up to my severe, massive widowmaker heart attack and subsequent cardiac arrest. But I experienced a number of inconsistencies, incompetencies, and really lack of personalized care. So I created Tom's Heart as a personal healthcare advocate in your pocket. So Tom's Heart is a system backed by a AI platform called Sidekick platform. And I'm partnering with an organization called Champion the Challenges, which has been helping stroke patients recover from stroke for a number of years. So this application allows you to ask questions around medicine, around mental health care recovery, around physical recovery, around diet, exercise, all the components that go into recovery. And not only ask questions, but watch videos, look at what American Heart Association calls infographics, listens to recovery stories of other individuals like yourself and myself to see how they went through the recovery process. Because what better way to learn than to learn from others that have gone through the same process as you? It'll also in the future allow you to upload your medical records, allow you to interface with your pharmacy, your doctor's office, receive notifications on how you're progressing to your goals. The American Heart Association has something called care plans, which give you a guided approach, 87 days on how to recover, and incorporate that into Tom's Heart to give you daily reminders, notifications, give you integration into third-party applications like Fitbits and Apple Watches to monitor your heart rate, your sleep patterns, your eating, your diet, exercise, all the other components that go into your recovery. This particular video is going to demo Tom's Heart, and there's been other videos I've done prior to this that cover different aspects of the recovery, but this one is talking about mental wellness. And for me in particular, as I went through the process, the physical recovery was challenging. Yes, I couldn't walk a few blocks because my EF was around 15 when I had the heart attack, and even when I went home after the heart attack, it was around 30, so my ejection factor was 30. And the physical recovery was challenging, but I think without mental wellness, without getting into a right state of mind, without having a lot of fortitude, without having a spiritual aspect to recovery, it's very, very, very challenging to recover. The other aspect, I think, is medicine management, and you can watch the demonstration on medicine management. And in fact, I call this theory my M&M theory of recovery. So it's mind, your mental health, which I'll talk about, and we'll see some questions, a series of 10 questions I'll ask Tom's Heart, as well as recovery through medicine. So M&M is mind and medication. The other thing before I get into the demo that I wanted to mention is I did a lot of things. So a lot of things to help out my spiritual, mental, emotional recovery after. There's a meditation mindfulness process called Art of Living. I partake in a weekend of Artful Living, which goes in through various breathing and meditation techniques. I've always meditated. I've been meditating for about 25, 30 years. Meditation played a key role in my recovery. Behavioral therapy played a role. Like I said, I was suffering from anxiety. I couldn't sleep. I felt like I didn't know what to do. As my girlfriend said, I was like a cat on a hot tin roof at certain points in time, where the mental aspect just became overwhelming. So I went to behavioral therapy, went to psychotherapy, did yoga, I did mountain biking, I did fishing. Through this whole process, actually, I learned And I sort of knew this before I had the heart attack, but working out, for me, it's a good physical release. It's a way to keep healthy. It's a way to ensure that I'm constantly having good blood pressure and heart rate and the things that exercise do for you. But I also feel like working out to me is one of my biggest coping mechanisms. So, what working out does, it allows me to calm my mind, be more focused, to get rid of sort of that excess energy that you have. And so, I really became evident through the heart attack recovery that working out, exercising was one of my biggest coping mechanisms in life. And it was very traumatic to not have that for a while after the heart attack. I mean, granted, I was walking, I was doing things, but I wasn't able to physically do the things I was able to do before the heart attack. So let me get into the questions I have here. And I'm going to ask Tom's Heart. Once again, wanted to mention this is American Heart Association data. It's public information that's available on their websites. I loaded it into this AI-based application called Tom's Heart, and I will ask some questions there so you can get an idea of how this application might be able to help you. Lucas, I've gone through this heart attack experience and cardiac arrest. Why do I feel anxious and depressed and disconnected at times?
Experiencing anxiety, depression, and a sense of disconnection after a heart attack and cardiac arrest is not uncommon. Such events can be traumatic, and the emotional impact can linger as you process the experience and work through recovery. These feelings might be attributed to psychological stress, changes in lifestyle, or concerns about health. Understanding these emotions and seeking support can be key to managing them. If you'd like, I can connect you with Jamal for the Impact of Mental Health Treatment on Heart Disease Content Library item to explore mental health strategies for heart disease recovery. Would you like to explore this with him?
So, as you might have witnessed here or sort of seen, is that Lucas is sort of this main, look at it as like a primary care physician. So, your main point of contact as you recover, your personal assistant for recovery. And then there's various other specialists, if you will. And Lucas was pointing out a specific specialist, Jamal, I believe it was, that could dive deeper on a particular topic. Is it normal, Lucas, to feel overwhelmed and maybe even unmotivated at times? Before the heart attack, I always felt like I had a lot of energy. I felt motivated. I felt eager to participate. But sometimes I'm like a little bit reluctant to maybe go out and exercise.
Feeling overwhelmed and unmotivated after a heart attack is quite common. Such experiences can have a significant impact on one's mental and emotional well-being. The recovery process can be challenging, both physically and mentally, as your body and mind adjust to new circumstances. It's important to approach recovery with patience and to seek support when needed. Exploring strategies for stress management and engaging in cardiac rehabilitation programs can be beneficial in regaining motivation and energy. Would you like to explore related resources or connect with an expert sidekick for more support?
Lucas, how do I cope with the fear of this happening again? Like in any traumatic incident, post traumatic stress kicks in, like, oh, this could happen again at any given point in time.
Feeling fear and anxiety about the possibility of another heart incident is natural and common. Coping with these feelings often involves a combination of stress management techniques, professional support, and lifestyle adjustments. Practices such as mindfulness, meditation, and therapy can be effective in managing post-traumatic stress and reducing anxiety. Would you like to explore the impact of mental health treatment on heart disease content library item with Jamal? This item covers treating anxiety and depression to improve heart health outcomes.
Well, Lucas, speaking about therapy, can therapy or support groups help me, and how can those two things help me?
Therapy and support groups can play a crucial role in recovery after a heart event. Therapy provides a space to process emotions, anxiety, and traumatic experiences, offering strategies to cope and improve mental well-being. Support groups offer connection with others who have gone through similar experiences, fostering a sense of community, shared understanding, and encouragement. These resources can be beneficial in addressing emotional and psychological challenges, reducing feelings of isolation, and promoting a positive outlook on recovery. Would you like to explore more about mental health treatment's impact on heart disease outcomes with Jamal, the expert sidekick?
Lucas, how do I make sense of this entire experience from a spiritual perspective?
Finding meaning or understanding a heart incident from a spiritual perspective can involve reflecting on personal beliefs and the life changes it has prompted. Spiritual discussions or guidance can help you navigate these feelings by exploring the deeper significance of your experiences and fostering a sense of peace and resilience. If you wish, I can connect you to Mike, who is the spiritual support expert sidekick. Would you like to explore this with him?
Lucas, more generally, when and will I ever feel like myself again?
Recovery after a heart event is a deeply individual journey, and feeling like yourself again will depend on various factors, including the extent of the heart damage, how well you adhere to lifestyle changes, and how you manage your physical and emotional health. For some, it could take months. For others, it might be longer. Participating in cardiac rehabilitation, engaging in regular exercise, and accessing support groups can facilitate this process. Would you like to explore some resources that might assist in your recovery journey?
Lucas, how do I find meaning and purpose in life after this incident?
Experiencing a heart incident can prompt profound reflections on life's purpose and direction. Finding meaning often involves reconnecting with what matters most to you, whether it's relationships, passions, or personal growth. Exploring spiritual perspectives, engaging in fulfilling activities, or seeking guidance through therapy can help provide clarity and purpose. If you're interested in discussing this with Mike, the spiritual support expert sidekick, let me know, and I'll connect you.
Hey, Lucas, it seems like my mindset has been altered since the incident. Sometimes, and many times, for the better. Can you tell me about what is happening here?
Experiencing a heart incident can indeed alter your mindset, often leading to a renewed understanding and appreciation of life. This shift can bring about positive changes, such as an increased focus on personal health, relationships, or finding new purpose. It's a natural response as you process this significant event and reassess priorities. If you feel any negative emotions persisting, support from therapy or joining a support group can be beneficial. Would you like to connect with a specific expert sidekick to explore more about mental health support and adaptation after a heart event?
Well, Lucas, right after the incident, I did have severe mood swings. I find that I erupted often, got angry sometimes at the slightest provocation. Is there someone or something that can help here?
Experiencing mood swings and anger after a heart incident can be part of the emotional recovery process. It's important to address these feelings to support your overall well being. Engaging in mental health support, like therapy or counseling, can provide strategies to manage these emotions effectively. Jamal, the expert sidekick, leads the impact of mental health treatment on heart disease content library item, which might offer valuable insights and support for managing such feelings. Would you like to explore this item with him?
I'm going to ask one more question and then go into a quick summary. I'd like to know, how do I concentrate at work when I'm constantly worrying about my heart and my health?
Feeling worried about your heart health while trying to focus at work can be challenging. Implementing stress management techniques, such as mindfulness or meditation, can help maintain concentration and reduce anxiety. Taking regular breaks, organizing tasks, and setting achievable goals may also improve focus. Would you like to explore more about stress management with Maria's Stress Management and Mindfulness Content Library item?
So that was a demo of 10 questions around mental health, spiritual well-being. The application, like I mentioned, uses American Heart Association public information. I'm working with the Sidekick platform along with the Champion Challenges organization to enter into the American Heart Association 2025 Care Plan Challenge, which allows access to private information that American Health Association has, or Heart Association has. And so look out for some demos around using some of that data that's available. And I would like to say you can go back and watch some other videos that I did earlier, as well as a video coming up next that's going to be around exercise and nutrition. Certainly, if you have any enhancements, any recommendations for this platform for Tom's Health, certainly let me know. I'll have a lot of links below in terms of the other videos and demos that are available, as well as a blog post and video on my entire heart recovery journey, and links to the Champion the Challenges and Sidekick platforms. Thank you and have a great day.